See, today I am going to break a myth about walking, running, treadmill, skipping, okay, in relation to overweight, high blood sugar, high blood pressure, and bad cholesterol. Okay, I think you would have seen so many people, they go for daily running, morning 1 hour and evening also they spend some time for walking or running. Have you seen? I have only one question to you. If a person is weighing, for example, 80 kgs or 85 kgs or even 100 kgs, okay, so let it be 100 kgs. If a person weighing 100 kgs is going for a fast running, do you know what will happen to his heart rate? His heart rate, he will have increase in his heart rate. That is called tachycardia, massive tachycardia. That is very, very dangerous to life, massive tachycardia. And he will also have knee joint pain. And he cannot even sit for the toilet. So, and one more thing, if a person goes for slow walking for 1 kilometer, he can burn maximum only of 40 to 50 calories. Right? Just hear this correctly. If a person is going for slow walking, I am not speaking about running. If a person is going for slow walking for 1 kilometer, he can burn maximum 40 to 50 calories. That means if he walks for 5 kilometers slow walking, he can burn maximum of 250 calories. Right? Got it? 1 kilometer slow walking, you can burn maximum 50 calories. So, if you want to burn just 250 calories, you have to go for slow walking for 5 kilometers. My question is it possible for an overweight person weighing 100 kgs to go for 5 kilometers walking daily? Is it possible for a 100 kilogram weighing person to go for 5 kilometers of slow walking? I am not talking about running. I am talking about only slow walking. Is it possible? 5 kilometers slow walking, 100 kgs. No, that is not possible at all. He will get difficult in breathing. After he crosses 1 kilometer, he will get difficulty in breathing. So he cannot go for a fast walking for 5 kilometers. If he wants to burn just 250 calories. So it is not possible, number one. Number two, is it possible in this busy world to go for 5 kilometers of walking by spending 1.5 hours? If you want to cover 5 kilometers by slow walking, you have to spend 1.5 hours minimum. Is anybody having that much time in this busy world? That is practically not possible. Right? Okay. Suppose if you are planning for fast running, if you go for fast running for 1 kilometer, you can burn maximum of 80 to 100 calories. First I told you about slow walking. 1 kilometer slow walking, you can burn 50 calories. Now I am talking about fast running. Fast running. 1 kilometer, if you do fast running, you can burn maximum of 80 to 100 calories. Okay. So now I am going to ask you another question. A person weighing 100 kilograms, can he go for fast running for 1 kilometer? Of course, sometimes it is possible. Can he run for 2 more kilometers? 100 kgs fast running? That is not possible at all. When an overweight person goes for fast running, he will have difficulty in breathing because of his increase in the heart rate. So automatically he will slow down his walking. So he will start as fast running and finally he will end up as slow walking. So he cannot burn or he cannot run more than maximum of 2 kilometers. Even 2 kilometers is not possible for a 100 kilogram person to run. It is not possible. Even if he runs for 2 kilometers, he will be burning only maximum of 200 calories. Is there any use? Just by burning 200 calories by walking 2 kilometers? Is there any use? No use. That is why I am telling you, only if you eat your home food in a balanced form with correct amount of protein, fat, vitamin, minerals and carbohydrates. That is balanced home food diet plan. Only if you eat your home food in a balanced form, you can reduce your body weight. Otherwise, it is not possible. Even if you go for slow walking, it is not possible. Even if you go for fast running, it is not possible to reduce your overweight just by running and walking. Because if you go for 1 kilometer slow walking, you will burn only 50 calories. If you go for fast running for 1 kilometer, you will burn maximum 80 to 100 calories. So is it possible to reduce your overweight with walking and running? It is not possible at all. It is not possible at all. Can you show me one person in this world who reduced his overweight just by going for slow walking and running? It is not possible. I am not telling walking is wrong. You must go for slow walking daily for physical fitness. I repeat again, you must go for slow walking only for physical fitness. My question is, can you show me one person in this world who reduced his overweight just by walking or running? Walking and running, if combined with, I repeat again, walking or slow running combined with a balanced home food diet plan, you can reduce your overweight. So the key point for overweight or weight loss journey is eating a balanced home food diet plan. I repeat again. So the key point or the important point in weight loss journey is you must eat your home food in a balanced form with correct amount of protein, fat, vitamin, minerals and carbohydrates. This is the key. Which one? Balanced home food diet plan is the important key. Walking and running comes next. In a weight loss journey, balanced home food diet plan should be the key, and walking and running should be the next key. People do this walking and running regularly and they do not concentrate on this balanced home food diet plan, which is most important. Balanced home food diet plan is most important, not walking and running. Right? So only if you eat your home food in a balanced form and combined with slow walking, you can reduce your overweight. And if you walk for 1 kilometer, you can burn only 50 calories, which will not help you much in your weight loss journey. I repeat again. If you go for slow walking for 1 hour, 1 kilometer, you can burn just only 50 calories, which will not help you much in your weight loss journey. Balanced home food diet plan is the key for a successful weight loss program from a qualified doctor. Only a qualified doctor knows how much protein you want, how much good fat you want, how much vitamins you want, how much minerals you want, right? How much carbohydrates you want, depending upon your height, your weight, and some diseases which you have. Maybe most of the obesity persons usually have sugar, pressure, bad cholesterol, fatty liver, gallbladder stones, PCOD complaint, PCOS complaint, irregular periods complaint, no baby complaint, male sexual problem complaint, male sexual problem complaint, male sexual problem complaint, male sexual problem complaint, constipation, indigestion, ulcer complaint, migraine headache complaint, knee joint pain complaint, depression complaint, heart problem complaint. Most of the overweight persons, I repeat, most of the overweight persons usually have sugar, pressure, cholesterol, fatty liver, thyroid, male sexual problem, constipation, irregular periods, PCOD, no baby, depression, everything. So if you want to reduce your overweight, you have to give importance for balanced home food diet plan and little bit importance for slow walking, because if you do a slow walking for 1 kilometer, you can burn only 50 calories. Any person giving importance for only for walking and running cannot reduce his overweight. I repeat again. Any person giving importance for only walking and running cannot reduce his overweight, because if you go for slow walking 1 kilometer, you can burn 50 calories. If you go for fast running 1 kilometer, you can burn only 100 calories. And an overweight person cannot run more than 1 kilometer. An overweight person cannot run more than 1 kilometer because he will have difficulty in breathing, and his heart rate will be massive heart rate. Increase in his heart rate, massive tachycardia. So he cannot run. So if you want to reduce your overweight, you should give importance for what? Food. Balanced home food diet plan is the key. Okay. One more question I want to ask you. So first I ask you one question. Can you show me any one person in this world who has reduced his overweight only by running? I told you the answer, that is not possible. Only a balanced home food diet plan along with slow walking, you can reduce your overweight. Okay. And one more thing. Most of the overweight persons usually have high blood pressure, sugar, cholesterol, and they'll be eating tablets for everything. They'll be weak. They'll be very, very weak. Have you seen sugar patients eating tablets for 15 to 20 years? Is it possible for a sugar patient to go for fast running. Is it possible? Is it possible for a sugar patient or a pressure patient or a cholesterol patient who was eating tablets for so many years and they will have knee joint pain, body pain, all problems they will be having? Is it possible for them to go for fast running daily for 2 or 3 kilometers? It's practically not possible. It is practically not possible. They can only go for slow walking for a small distance. They can only go for a slow walking for a small distance. And they might burn maybe 50 calories. Got it? So, if you want to stop all your unnecessary tablets and insulin, you must eat your home food in a balanced form. Got it? Because we know the reason for sugar, pressure, cholesterol and overweight. We know the reason for sugar, pressure, cholesterol and overweight. There is only one reason. Eating your home food in an unbalanced form. Because we know the reason for these 4 diseases, sugar, pressure, cholesterol and overweight, it is very, very, very easy to treat. I repeat again. Because we know the reason for major diseases like overweight, sugar, pressure and cholesterol, it is very, very easy to treat these 4 diseases. If you treat all these 4 diseases by balanced home food diet plan, you can live rest of your life without tablets and insulin. For example, if you are eating 4 tablets today, for example, if you are eating 4 tablets for one day, you will eat 1460 tablets for 1 year. Got it? If you eat 4 tablets daily, for 1 year, you will eat 1460 tablets. Take a paper now. Calculate how many tablets you have eaten so far. So, if you eat 4 tablets daily, for 1 year you will eat 1460 tablets. Take a piece of paper, write how many tablets you have eaten so far. So that you can think. See, overweight, sugar, pressure, cholesterol are the easiest diseases to be treated because there is only one reason for that: eating unbalanced food. So if you eat your home food in a balanced form with correct amount of protein, fat, vitamins, minerals and carbohydrates, you can stop all your tablets and insulin gradually, permanently and lifelong and live rest of your life without tablets and insulin. See, for example, if you are eating 4 tablets today, can you live with these 4 tablets for the whole rest of your life? For example, you are eating 4 tablets today. Can you live with the same 4 tablets for the rest of your whole life? Just think. There are so many persons eating sugar tablet, pressure tablet, cholesterol tablet, thyroid tablet, heart tablet, vitamin tablet for more than 15 to 20 years with no use at all. Even after eating for 20 years, they are again a sugar patient, again pressure patient, again cholesterol patient, again thyroid patient, everything. Only if you eat your home food in a balanced form with correct amount of protein, fat, vitamin, minerals and carbohydrates, you can live rest of your life without eating tablets. Got it? So I am telling you this again and again is, if you don't take step from today, to reduce your overweight, to keep your sugar, pressure and bad cholesterol under control by eating a balanced home food, if you don't take step, to reduce your overweight, to control your sugar, pressure and cholesterol by eating a balanced home food. I am not talking about tablet and insulin. I am not talking about tablets and insulin. I am not talking about unnecessary tablets and insulin. I am talking about eating balanced home food. If you do not take immediate step to reduce your overweight, to keep your blood sugar, bad cholesterol and high blood pressure under control only by eating a balanced home food, maybe after 5 years, you would have eaten this much of tablets. And you will feel sorry not only for yourself but for your whole family, because the dangerous complications of sugar, pressure and bad cholesterol, heart attack, stroke, eye blindness, kidney dialysis, leg finger removal and total leg removal. Be very careful. If you don't take immediate steps to keep your blood sugar or blood pressure and your bad cholesterol and your overweight under control by eating a balanced home food, you will suffer from dangerous complications like stroke due to high blood pressure, total eye blindness due to diabetes and blood pressure, heart problem due to bad cholesterol, triglycerides, sugar and bad cholesterol and high BP. You will have kidney dialysis due to high blood pressure and diabetes. We will have to remove the leg finger or the whole leg because of the complication of diabetes, which you are daily seeing, which we can see in our day-to-day life. So you must be very careful. Okay. So you must take very importance to eat a balanced home food diet plan. Okay. Don't concentrate on eating tablets and insulin. Right? Don't concentrate on eating tablets and taking insulin. Treat the cause. Very easy. Treat the cause. Eat a balanced home food. Keep your sugar, pressure, cholesterol and weight under normal. Stop unnecessary tablets and insulin. Right? So the discussion here is walking and running has almost no role in treatment of overweight, sugar, pressure, cholesterol. Because if you walk for 1 kilometer slow walking, you can burn only 50 calories. If you run so fast for 1 kilometer, you can burn 100 calories. And practically, a person suffering from overweight, sugar, pressure and cholesterol with eating this much of tablets, he cannot run so fast. See, this is a person, I reduced his weight 42 kgs. See, 42 kgs I reduced. See his weight, see his present weight. (42 kgs I reduced). See, this person is 58 years old. He is suffering from, he is having overweight, right? He is having obesity. He was also suffering from sugar, pressure, cholesterol. And he was taking so many tablets and insulin. Can I tell this person to run for 2 kilometers? Is it practically possible? For this person to run for 2 kilometers with overweight, sugar, pressure, cholesterol and everything? Is it practically possible? It is not practically possible at all. I reduced his body weight by giving a balanced home food diet plan. That's all. The speciality of my weight loss clinic: no protein powder, no juice, no walking, no running, no skipping, no treadmill, no tablets, no bariatric surgery, no protein powder, no juice, no walking, no running, no skipping, no treadmill. It is not possible. See, just think. Is it possible for this overweight person? Is it possible for this overweight person suffering from sugar, pressure, cholesterol, and eating so much of tablets and insulin? He has on insulin also. Is it possible for this person to run for 2 kilometers in the road? It is practically not possible. He cannot even walk fastly. 58 years old. It is practically not possible. That is why I am telling you. See, so many people are thinking that so many people suffering from sugar, pressure, cholesterol, fatty liver, overweight. They are running. They are just going for walking daily for 1 kilometer, thinking that everything will become normal. Shall I repeat? If you go for slow walking 1 kilometer, only 50 calories you can burn. If you go for fast running for 1 kilometer, you can burn maximum of 100 calories. Do you think it is practically possible for a person suffering from sugar, pressure, cholesterol, overweight to run fastly for 2 kilometers? Is it practically possible? Even if he runs for 2 kilometers, he can burn only 200 calories. Just think. Okay, let us forget about overweight. Person. Okay, suppose a thin person suffering from sugar, pressure, cholesterol, eating this much of tablets and insulin. I repeat the question. First I was explaining you about overweight person with sugar, pressure, cholesterol. Okay, let's forget about it. I am talking you about now a normal built person. That is a thin person. No overweight. Suppose around 60 years of age. Group. 60 years old person, thin built, suffering from sugar, pressure, cholesterol, and eating tablets, this much of tablets, insulin, and having so much of knee pain, all complication. Is it practically possible for this person to go for 2 kilometers running? No use. He cannot do that. It is practically not possible. Even if he is thin built and suffering from sugar, pressure, cholesterol for 20 years, they'll not be even able to walk slowly. Have you not seen? That is why I am telling you repeatedly. Only if you eat a home food in a balanced form, you can stop your this much tablets and insulin, and you can lead a healthy life, and you can attend your grandchildren's wedding. Do you want to attend your grandchildren's wedding? Of course, yes. Do you want to attend your grandchildren's wedding? Of course, yes. Everybody will say yes. To do that, it is very easy. You must eat your home food in a balanced form with correct amount of protein, fat, vitamins, minerals and carbohydrates. Stop all your unnecessary tablets and insulin. Stay healthy, stay fit, and attend your grandchildren's wedding in a healthy way. Do you want to attend your grandchildren's wedding? Of course, your answer will be yes. And is it possible? Yes, it is possible. Is it possible? Yes, it is possible. You have to do a small thing. You must eat your home food in a balanced form with correct amount of protein, fat, vitamin, minerals and carbohydrates. Stop all your tablets and insulin, keep it that side. Stay healthy and attend your grandchildren's wedding happily. It's very easy. See, I'll show you one more person, one more boy. 140 kgs to 70 kgs. I reduced 70 kgs for this boy. 140 kgs to 70 kgs. I reduced 70 kgs for this boy. If I tell this boy to run for 2 kilometers daily, what will happen to his heart rate? Just think. If I tell this boy to run for 2 kilometers, what will happen to his heart rate? He will have massive tachycardia, which is very dangerous to health. I think you would have read in newspapers. Some people, they are over 8%, they are playing badminton and suddenly they get fainted, spot death. I think you would have read this in newspapers, right? See, this boy is 140 kgs. This boy is studying 12th standard, 140 kgs. Can I advise him to run for 2 kilometers? His heart rate will be in, he will have suffered massive tachycardia. That is increase in heart rate. He cannot even go for slow walking. He is 140 kgs, 140, 12th standard boy. He cannot even go for slow walking. If I tell this boy to go for running for 2 kilometers and do treadmill and do skipping, it will be a wrong advice for him. It will damage his knee joint. It will damage his heart. Got it? Because even if he walks for 1 kilometer slow walking, he can burn only 50 calories, which will not help in his weight loss journey. So walking, running is good for health. I am not telling you don't go for slow walking. I am telling you have to go for daily slow walking only for physical fitness. Only for physical fitness. You must go for walking. Daily 1 hour slow walking is definitely good for health. Daily 1 hour slow walking is definitely good for health. I encourage that. But don't think you can stop your sugar tablets by walking. You can stop your pressure tablets by walking. You can stop your cholesterol tablets by walking. You can reduce your overweight by walking. That is not possible. Can you show me one person in this world? Can you show me one person in this world who went for daily walking without correcting his food habits, stopped any of the tablets and insulin? Can you show me one person in this world who went for regular walking without correcting his food habits, stopped any of his tablets or insulin? Shall I ask this question once more? Can you show me one person in this world who went for regular walking without correcting his food habits in a balanced form, stopped any of his tablets or insulin? No. I hope I made this video so clear to you. You cannot stop your sugar tablets by walking. You cannot stop your pressure tablets by walking. You cannot stop your cholesterol tablets by walking. You cannot stop your insulin by walking. You cannot reduce your overweight by walking. This is the carry home message. If you want to stop your sugar tablets, pressure tablets, cholesterol tablets, insulin, and if you want to reduce your overweight, it is very, very easy. Because there is only one reason. That is, you must eat your home food in a balanced form with correct amount of healthy protein, good fat, vitamins, minerals and carbohydrates. I, Dr. Shiban, specialized from world famous Madras Medical College, give balanced home food diet plan so that you can reduce your overweight without protein powder, without juice, without tablets, without walking, without running, without skipping, without bariatric surgery, without protein powder, without juice, right? If you eat too much of protein powder without a qualified doctor's advice, you know what will happen to your kidney, right? You know what will happen to your kidney. Be very careful, right? So this is the specialty of my weight loss clinic, and I also give diet plan for diabetes, fatty liver, PCOD, PCOS, hormone problems, male sexual problems, psoriasis, constipation, ulcer, overweight, what else? All the non-communicable diseases, almost all the non-communicable diseases can be easily treated if you eat your home food in a balanced form with correct amount of protein, fat, vitamin, minerals and carbohydrates. And one more last important point is diet plan for one person cannot be followed by another person. Diet plan given for one person for a particular disease cannot be followed by another person. So, I cannot give you a common diet plan. Some persons will be lean diabetic, so different diet chart. Some persons will be obese, BP, different diet chart. Some females will be thin built, PCOD, different diet chart. Some females will be overweight, thyroid problem, different diet chart. So, diet chart for each and every person will be different. Okay, diet chart for each and every person will be different. Please, I hope this I have made it very clear. So I started this story from walking and running, and I ended up with so many informations, right? So many informations. So the carry home message. So I want to tell you the carry home message, no? If you eat your home food in a balanced form, you can escape from dangerous complications of sugar, pressure, cholesterol and overweight. That is stroke, total eye blindness, heart attack, kidney dialysis, leg removal or leg finger removal, which are all the dangerous complications which you know better than me. So this is the carry home message. If you want to live your life without entering an intensive care unit, if you want to lead your life without entering an ICU, you must eat your home food in a balanced form. Not from tomorrow, from today itself. And you should take all effort to keep your blood sugar, BP, bad cholesterol and overweight under control, and stop all your unnecessary tablets and insulin. Okay, I hope I made this clear. I made this video so clear to you. Please forward this video with some of your good friends who need this information. Okay, stay tuned with Dr. Shriban. Thank you so much. Thank you.